for having me. Good to see so many familiar faces. Heidi Marston, for those of you I don't know, I'm Interim Executive Director of the Los Angeles Homeless Services Authority, or LAHSA. Slow clap. So LAHSA is a joint powers authority between the city and the county of Los Angeles, for those of you who aren't familiar, and we are charged with overseeing our community's response to homelessness collectively. We're also the continuum of care lead for our community. So we receive funding from HUD, from all across the federal government, from the state, and from our local efforts like Measure H. So initially, I think I was going to come back to talk about our gaps analysis. We haven't released our gaps analysis yet for a number of reasons. As you can imagine, our system is very complex, and getting our arms around the entire portfolio is a challenge. So we're nearing the time where we can be able to release something to you, and I'm happy to answer questions to that vein today. So I thought I would use some of this time to just give you an overview of what homelessness is looking like in Los Angeles. We are on the heels of the next point in time count, which is next week, and I'll pitch volunteering to all of you at the end of this as well. Still need volunteers. So this is an overview of the state of homelessness in California. So as we know, last year during our homeless count, the entire state of California saw an increase, a pretty significant increase in homelessness, which we know is coming from an affordable housing crisis that's driving people into homelessness. The average across the state was a 35% increase in homelessness. In Los Angeles, we saw a smaller increase than that, largely due to the local resources that have been placed and given to our community thanks to the taxpayers. So in LA County, we saw a 16% increase in the city, 12% increase in the county, nearing about 58,000 individuals, 59,000 individuals who are experiencing homelessness during our last point in time count, which was last January. And then within that, we break it out and we look at all of the different demographics of who are the individuals who are experiencing homelessness, veterans being a key part of that. And last year, we saw almost flat. Veterans didn't necessarily go down, they didn't necessarily go up, they stayed level. The most fascinating thing to me, and we saw this across all demographics, was that if you look at the 2018 count, you had about 3,800 veterans experiencing homelessness. During the year of 2018, there were about 2,800 veterans housed, yet at the end of the year, you still have about 3,800 homeless veterans. And that's consistent across all of our demographics. And what it's telling us is that people are falling into homelessness for the first time at a rate that's much faster than we're able to bring people out of homelessness. Veterans, I think, stayed level largely due to the significant federal resources that are invested. And so something that we push at LAHSA a lot is using the veteran model, the HUD-VASH model, and the way that the federal government has responded to veteran homelessness as a model for the rest of the population that experiences homelessness. We know that the systems and the approaches and the resources that come to veteran homelessness specifically are working. Even though we aren't necessarily seeing those decreases, we are seeing more progress than we see in other populations. This is just a breakdown of ethnicity, and as you probably know, last year LAHSA convened an ad hoc committee on Black people experiencing homelessness. This was largely driven by the fact that in our prior point in time count, we saw that Black African American individuals represented more than 33% of our population who was homeless. However, they represent only 9% of the total population. So we wanted to dig into that to understand why is there such a misrepresentation of Black and African American individuals experiencing homelessness. There was a report that was published. If you're interested, there's some really fascinating recommendations and findings. But part of what has shifted our approach are those recommendations to say, how do we make sure that as we're addressing homelessness as a system, we are not perpetuating the structural and the institutional racism that has driven people to experience homelessness in the first place, undoing bad policies around housing, undoing bad policies around how programs are funded, and making sure that we're applying a racial equity lens in all of our programs across the board. So it's a fascinating report if you haven't seen it. The myth we always hear, I worked here at the VA prior to going to LAHSA. I heard it here. I still hear it at LAHSA all the time. Everybody in Los Angeles who's homeless must come from somewhere else. The mayor of Chicago must put everybody on a bus in the winter and ship them to LA. That's why we have such a high population of homelessness in California. And frankly, what we see time and time again, year over year, is it's just not true. Majority of people who are experiencing homelessness in LA, veterans are no exception, are largely from LA, and over 80% are from California. So there is a small population that migrates, and I think that's true for every state. But generally speaking, the people who are here have been here for more than 10 years or even longer and are residents of California, and likely fell into homelessness while living in California. This has been the most eye-opening piece from our last point in time count, and I'm confident that our next point in time count is going to reaffirm the same thing. So we look a lot at why are people falling in and what are the driving factors. And when we talked to individuals, 53% of individuals experiencing homelessness cited economic hardship. So that's anything from the loss of a job, the loss of a loved one or a support network, a medical condition that might be impacting income. So that was the first piece that I think was really telling. The second piece is, for the first time ever, we see that more than half of the people who are experiencing homelessness, that almost 59,000 number, are on their first episode. So these aren't people who are coming in, they're falling into homelessness, they're getting housed, they're falling out, they're going through the cycle. These are people who are falling in for the first time because of economic reasons, simply because they can't afford to pay their rent. I'll go into a little bit more detail on what that looks like, but having the need to address the affordability crisis that we have and the fact that our wages are not keeping pace with the rising rental costs is a tremendous driver, in addition to some of our other systems of care and how they kind of approach our homelessness system, which I'll also talk about. These are just a couple of key facts. I won't go through all of them, but generally speaking, 555,000 LA County households are considered severely rent burdened. So that means they're paying more than 50% of their income on rent. Those are the people that we really want to target and look at. They're one crisis away, they're one job loss away from falling into homelessness. So how do we make sure that we're wrapping safety nets around them so that they don't fall in? Because as we saw in the last slide, once you fall in, it's becoming harder and harder to come back out of homelessness because of the massive influx that our homeless system is seeing. And then LA needs approximately 516,000 new affordable housing units just to meet the needs of low-income renters. That's net new. That's not existing units that would be converted into affordable. So there's a lot of action right now being taken by the state and the federal government to look at how we propel this forward. Locally, we're doing a ton to this, but frankly, until we are able to address the affordability crisis here, we're going to have a hard time seeing decreases in this population. I won't go into this significantly, but for those of you who aren't from Los Angeles, you may have heard of Measure H or Proposition HHH. These are measures that were voted on by our taxpayers to essentially tax themselves to support this effort around ending homelessness in Los Angeles County. So Measure H provides $355 million to $400 million a year in resources that come through LAHSA to our providers to provide services, everything from outreach to safe parking to permanent housing across the whole spectrum. And as I said earlier, but for this investment, I think we would have seen a much higher increase than we have seen than the rest of the state saw. We would be more comparable to them. And then Triple H is a bond measure estimated to bring on 10,000 units of permanent housing. The first units just opened last week, and there are more coming online. So this again, it speaks to that net new affordable housing stock that we desperately need. And then this is just a little more information about Triple H and the units that we're scheduled to bring online. There's a ton of construction happening, and the city, county, and state are working actively to do whatever we can do to make affordable housing development as quick as possible and as inexpensive as possible. And then this speaks to kind of the theme of what I've been talking about too. Even though we saw an increase last year, we saw a 12% increase, what we see year over year is our system as a homeless system is performing better each year. Last year, there were 21,000 individuals who were housed, which is almost double what we did in 2014. So as more people come in, we're becoming more efficient. We're learning how to house people faster, but people are coming in so quickly that you can't keep pace. And then this is just a visual that I like to use that kind of explains to folks how this happens. So, as I said before, we have 555,000 severely red burdens. So these are the people who are literally on the verge, and there are safety nets in place that we want to make sure we're utilizing so they don't fall and come to the door of the homeless services system. A big part of our effort right now is prevention. So how do we make sure, like I said, that we're targeting those folks who are severely red burdened and at risk? So last year, our system prevented about 5,600 individuals from falling in. So definitely an impactful number, but more work to do. In 2018, we had 52,765 individuals experiencing homelessness. We estimated that over the course of the year, about 55,000 people fell into homelessness. We know that we housed the 21,000, about 22,000 people. Other exits, so there are a lot of people that fall into homelessness who are able to resolve on their own, so they aren't placed into permanent housing through our system, but through other means, they may have moved in with a family member, obtained a job, and got their own apartment. There's a variety of ways that happens. And that's what gave us the nearly 59,000 number. So again, until we can prevent this number from increasing, it's going to be harder to see a decrease in the 59,000 number on the other end. So where do we go from here? I think continuing to advocate for increasing affordable housing stock and availability, limiting our rental increases. There's a ton that the state has been doing to do that. Preventing unjust evictions to make sure people aren't falling in unnecessarily. And really, when you think about it, there's a number of safety nets. There was a study recently published by the California Policy Lab, if you're interested in looking more at this prevention idea. And they looked at how could we predict homelessness, and is there a way to look at populations that are at risk and really predict their probability of falling in. And what they found was in LA County alone, the vast majority of single adults who fell into homelessness have some sort of heavy interaction with our other systems. So that's anything from child welfare, from criminal justice, from Department of Mental Health, health services. So these aren't people that we don't know, they're known to our system. So how do we work with our other mainstream partners to identify those folks so they don't come to the door of the homeless services system, which is overloaded with people who are already actively experiencing homelessness. And last but not least, next week is our point in time count. We need 8,000 volunteers. That's it for this year. We have 5,500 already, but we need more. So if you haven't signed up, please sign up. It's going to be across the entire county over a 3-day period. It's a great experience. I hear people all the time ask how they can help. What can the general public do? And this is something that's very tangible that you can do. It's a short commitment, but incredibly important for us in understanding who these individuals are and how we can better serve them, how we need to tailor our programs to support their needs. And you can sign up at theycountwillyou.org. So that's my pitch, and I'm happy to answer any questions or comments.
Okay. Okay, let's start with Dr. Davis. Okay, Dr. Bamberger and then Dan.
Hi, I'm Josh Bamberger. Nice to see you again. Wonderful presentation. For those of you who aren't familiar with this field, she just went through absolutely all the evidence base about what homelessness in California is all about. So if you want to see what the evidence is, this presentation was as succinct as you can get, and it was fantastic from my perspective. Specifically for the VA, we have the leadership of the VA Medical Center here. There's really important information that came out of the Cal Policy Lab study about how better to use our limited dollars around prevention. And the VA has a robust prevention effort, mostly through the SSDF funding stream. What can you see, with your experience with the VA in the past, your present role with LAHSA, that the VA can do better with the data that we have to use our limited prevention dollars to stop this extraordinary inflow, which is absolutely job one.
Yeah.
We're doing a great job in the VA of housing people with lead vash, but we cannot keep up with it if the inflow continues. And we only have limited money for prevention. So where should we use our data to better focus our prevention dollars?
Yeah, I appreciate that question. I think the VA is uniquely positioned in the prevention work, specifically because you are such a robust medical system. So if we look at housing as a social determinant of health, and we use our opportunities that we have to engage with the people who we serve through our hospital services and through our mainstream hospital system, and we understand the risk factors collectively across the VA, so not just clinicians who are in the homeless services side, but clinicians across VA understanding what risk factors look like and identifying those early. Because the VA tends to have so many touch points with our patients, the VA can identify those things faster and target prevention resources sooner. So that's something that we're trying to do with some of the other big systems like Kaiser, for example, is saying, you know, in your medical evaluations, in your triaging, what sort of questions are you asking on housing stability to make sure that we're identifying those folks who are at greatest risk. And if there's a way to leverage the opportunity you have with your existing patient infrastructure, your existing appointments that you have, to make sure that housing stability is a reality for all these patients, I think the easier it would be to target prevention services before people get so far down the road that they need a much more significant intervention.
I guess I want to push a little more specifically. The Cal Policy Lab's data shows us that if people come in contact with the welfare system, the social support system, over, I think it's 3 or 4 times in a month, then their likelihood of becoming homeless jumps up, I'm going to make up the number, 10 times. And right now, our prevention dollars, for every 10 veteran who asks for assistance in avoiding homelessness, only 1 becomes homeless. Right? I'm going to say that again. So every 10 people who ask for assistance around prevention veterans, only 1 become homeless. That's an extraordinary amount of money that we have to spend for 9 people who don't need it. What can we do better, and what specifically do we, I want to think about across the VA system. Could you imagine some sort of a flag system that if someone hits 4 or 5 times asking assistance in these various different VA areas, that they would then highlight in the CPRS medical record that they are now at greatest risk for homelessness, and we should have our outreach team go there and engage them with a lawyer and help them develop both shallow rent subsidies so they become homeless. Specific things like that. Anything that you can help to point, or any working groups that can help the leadership to know where they should go to find this high quality information.
Yeah, I mean, you're talking about it right there. I think the electronic medical record, CPRS, is the greatest weapon that you have to combat homelessness in the VA, whether it's creating some sort of alert system or flag system to identify those folks. We have a number of working groups right now that are in place to think about how do we help infiltrate these mainstream healthcare systems to identify these individuals in the private sector, but the VA kind of already has that infrastructure set up that could potentially be something that you could easily, I would think it would be easy to build out, but you never know. But it is something that's worth pursuing. The other piece that we found really successful that we're testing at LAHSA, we're one of the first jurisdictions to actually do this across the country, is we've established a fund. We call it a problem-solving fund, which is literally just a pot of money that we put dollars into. And when people go through this 3-day training we have, it could be a clinician, it could be a service provider. We're even going to train some of our elected offices staff who are hearing from constituents who are at risk of homelessness. If you go through the training, you have access to this flexible fund to say, this person is going to become homeless, all they need is a plane ticket to their mom, and we've validated that she's there, let's buy the plane ticket. So thinking about creative solutions, it could be 1 month of utility bills that this person needs just to stay in their unit. But giving that tool to as many people as possible and creating a fund that's very, very flexible so that whatever the unique need is, understanding homelessness is dynamic and everybody has a different situation. We've already started to see great success in preventing people, but I think scaling that to the VA side and across our whole system is going to be critical to stopping that inflow that you're talking about.
Dan.
Hi, Dan Rosenfeld. First of all, thank you for what you do, and God bless you. It's not easy. My question has to do with the cost per bed, if that's the right read that it may cost $500,000 or $600,000 for each unit of permanent supportive housing, which is about twice what my apartment developer friends tell me market rate unit cost. Is that number correct? And what can we do about it? Can we get more units for the dollars already committed?
So that's a good question. And so when you talk about $500,000 a bed, are you talking about per unit, like permanent housing unit, right? So that is a cost that's been floated out there. That is not direct cost to the taxpayer, however. So through Measure H, where we have these bonds, it's costing us about $80,000 to $100,000 a door. The rest of the money is leveraged through private funding sources and through development fees and all of those things. So cost to the system is really only $80,000 to $100,000 a door. When you compare that to the cost of shelter right now, given the fact that we have this immense crisis on our streets and the people experiencing unsheltered homelessness is at its all-time high, there's a lot of work right now and efforts being done to say, how do we build up shelter as quickly as possible? I think that's part of the answer, but shelter without housing on the other end just becomes very expensive temporary housing. So what we're seeing is that for every one shelter bed, we need 5 permanent housing resources on the back end, so we have the throughput. So to the extent that a shelter bed costs $80,000 to build and a permanent housing unit costs $100,000 to build, in the long run, it actually becomes cheaper to build a permanent solution as opposed to the temporary solution. So I think proportionality is a really big piece of this, making sure we are addressing needs and the safety of those who are on the street, who are unsheltered, but also creating the back-end solutions so that once people hit the shelter, right now they're staying up to 2 years because there's just nowhere else for them to go.
Okay, over here, we'll just walk down the table. Hamilton, Rob, Anthony.
Good morning, Chris. Good morning, great presentation.
Testing. Now I'm going to move for the record. Your state of homelessness slide, it says 53% of people experiencing first-time homelessness cited economic hardship as a leading factor. What is the other 47%?
It depends on the situation. So economic hardship is a big piece. So is involvement in criminal justice system. We know that people who are exiting institutions oftentimes don't have an exit plan. They tend to fall into homelessness or have a higher rate of falling into homelessness. Substance abuse and mental health is a factor. Physical illness is certainly a factor. It's not the predominant factor. But at the end of the day, I've never seen a case where there was one thing that drove somebody in. It's usually a very complex set of reasons, with economics being kind of the straw that broke the camel's back, if you will.
Yeah, that was my follow-up question. Was it's a affordable housing crisis, but there seems to be many other variables. Everyone wants to prescribe one thing, and it's multiple.
Yeah.
What are the other leading factors to make up the 47% that's missing up there?
Those would be so individuals exiting institutions are a big proportion. So that wouldn't necessarily be economics. It would just be poor planning as you're exiting institution, be that a hospital or jail. Also mental health, substance abuse, physical health, and inability to obtain income in any way. And then frankly, when you have income not being substantial enough to actually pay rent. And honestly, so in Los Angeles, the housing subsidy piece is a really big issue too. So from the Section 8 side alone, last year our housing authority in the city of LA opened up the wait list for Section 8 housing vouchers. It was opened up for the first time in 25 years, and it was only accepting the first 15,000 people that applied, and it filled up within 3 days. So it speaks to the need and the desperation that people are feeling right now for those vouchers and those subsidies. So
Thank
it's
you.
a variety, yeah.
Hi, Rob Eglin. Thank you for the presentation. I thought it was a great overview. You persuaded me with the data that we're not going to build our way out of this crisis. And to kind of echo Josh's point, it becomes essential to prevent the entry into homelessness. But all the same, we face this practical problem that we'll fail at that task on some level. And we have to plan for some level of failure. So then the question becomes, how do we build the most units, the most responsibly and the most efficiently? And all of us who just read the LA Times and follow the city question I wanted to put to you, and you have a really interesting perspective because you have exposure to the VA system as well as knowledge of the county's needs, is as you look at our project and what we're trying to do here, is there opportunities you can think of for unconventional approaches, maybe innovative approaches to certain construction techniques? So for example, I know that Garcetti has been pushing for, in his Office of Innovation, modular construction techniques, other ways of building housing quicker. Is there anything as you look at the campus where you think, or you might want to consider looking at one or two of these things that are a little off the beaten track, but maybe the types of things you can experiment with just because you're not on the conventional mold. What you're doing here is a little bit.
Yeah. I think it is in all of our best interest to explore any housing option that provides a dignified space for someone to be. It doesn't need to be the Rolls Royce of a unit. There are a lot of other communities that are utilizing things like the shipping containers, like tiny homes. I think it serves all of us to look at every single one of those options and not just rule it out instantly because we have such a crisis on our hands. The other piece we're shifting to, just because we frankly need to, is this idea of shared housing. Because we have a high volume, particularly of youth who are experiencing homelessness, but even across the board, when somebody comes to our system, we can be very honest with them about the likelihood of them getting a housing voucher and moving into their own apartment. It's low. Right now, in our system, we have 30,000 people who have said, yes, I want housing, yes, I want services, and we have nothing to give them. That's a long line. So to the extent people are willing to explore shared housing options, having a roommate and sharing a kitchen, and utilizing some of these 2-bedroom and 3-bedroom units that tend to go vacant, that's something that we should be doing early on as people are entering into the crisis, so that we're setting expectations and being really realistic about what the truth is. But to your point, I think we should be exploring all types of housing and anything that puts a roof over people's heads. Really.
Kathy? And then Mr. Montgomery.
For the new members, one of the reasons why we requested a briefing on the 2018 gaps analysis was because of the recommendation we passed at the last meeting to expand emergency shelter capacity on campus from the 100 units that will hopefully open in March to potentially 400. And time and time again, we were told that there was no need for that. And we came across the 2018 LAHSA gap analysis. Can you bring it up? Table 9 specifically addresses the gap analysis for veterans. And in the report, it says that there's approximately a need for 703 emergency shelter beds. So if we're looking at the community, if we're looking at LAHSA's data, LAHSA being the local homelessness authority, and LAHSA is saying we need 703 emergency shelter beds for veterans, and VA is coming back and saying, no, we don't, that's a problem. And when we asked for the information, the evidence, Dr. Bamberger talked about evidence, we asked for the evidence from VA to support why they're saying 0, we didn't get it. And so, do you believe that there is a need for more than 100 emergency shelter beds for veterans in LA? It doesn't necessarily need to be on this campus, but just in LA.
Yeah. So what I can tell you is, as we're going through our gaps analysis, the point of the gaps analysis is to look at what our resource need is given a system that's functioning in the way it's supposed to function. So there are assumptions we need to make to say, we're going to evaluate shelter and the need for shelter based on the assumption that people are actually moving through shelter. The landscape of the 2018 gaps analysis, or I think it was 2017, 16 or 17.
It's a 2018 report that references the 2017 data.
Yeah,
so I assume 2019 will
yeah.
reference 2018 data.
Yeah. So even since this moment in time, there have been thousands of new shelter beds that have come online for the whole system. And as a sneak peek, what we're seeing in our gaps analysis now is for our entire system. If we have a system that's functioning the way it's supposed to, which means we have the permanent housing resources on the back end, based on what we currently have and the planned projects in the pipeline, we have enough shelter. And it's not about building more shelter. And it would be like saying we have 44,000 unsheltered individuals right now who are on the street, so we need 44,000 shelter beds. That's just not what we see. We see that if we do have a system that has throughput and people can move through in a 6 to 9 month period, we actually do have enough shelter beds. So in a system that has limited resources with hard decisions, our recommendation is to put the funding into permanent solutions so that we can maintain the throughput. But that's always part of the challenge is like, what do you do with the need right now? And you talked about it earlier, there is no silver bullet. But when we look at our system capacity, we're pretty close to having the amount that we need given the crisis.
So you're saying that potentially in the 2019 report, that number would be 0?
Or within the hundreds,
Within,
yeah.
within the hundreds?
Yeah, we have, I think, 13,000 right now across the entire county, not just veteran specific, but
Right.
everything, yeah.
When you were working at CSRS, did CSRS publish a gap analysis?
I don't think there was when I was there, no.
I mean, we've asked around, nobody has seen one.
Yeah.
There wasn't one.
Yeah.
But you mentioned something that I think is important, that the idea that shelter without housing is a bad idea. And the unique opportunity on the campus is that it could be, there is an off-ramp, and the off-ramp is the housing is
Yeah.
going to be built on campus,
Yeah.
right? So the idea of putting emergency shelter here, if veterans find housing in the community, fantastic.
Yeah.
That's an ideal situation, and that's the goal, but we know that that's easier said than done, right?
Yeah.
And I think the LAHSA dashboard puts the average placement around like 94 days. Is that right?
Yeah, that's about right.
Do you find that it's been more difficult for veterans with a voucher versus non-veterans with a voucher?
No, that's not been the experience. Oftentimes, it's a little bit easier for veterans because the voucher rate for veterans is higher than the standard voucher payment rate. So, not to say there isn't challenges, because there certainly are, but I think having a voucher that's worth more is certainly helpful. So there should be, the challenges that the VA would have would be the same as with the community.
And the reason why I bring it up is there's been a bill, I think it passed, that specifically addresses housing discrimination against veterans.
Yeah.
So clearly, there's been cases in which
Oh,
veterans
absolutely.
were not granted housing, even though that they were holding a voucher in
Yeah,
hand.
and to your point, there's also legislation passed now that landlords can't discriminate on source of income. So it's the veteran population specifically and its source of income that we're seeing across the whole state, honestly, where that's happening. And so trying to enforce that is a huge piece of moving people through.
I still continue to believe that this idea of putting emergency shelter on campus is a good idea, knowing that there is going to be an off-ramp on campus.
Yeah.
It's not to
Yeah.
say that they're gonna be stuck here and they can't get housing in the community, but
Yeah.
worst case scenario, we're gonna have housing for them.
Yeah, and listen, I'm not saying that if there are potential solutions and options for building fast emergency shelter to get a roof over people's head tonight, I'm not saying that shouldn't happen, but I'm saying in a world where we have $100, that the $100 would go to the permanent housing resource as opposed to the shelter. But if there's sufficient supply and there's sufficient resources to be able to build more, and you see, especially when the ADH site opens here, you see it filling up quickly, and if you're seeing it maintained at that level, then yeah, look at it.
Well,
Yeah.
I'm glad you brought that up, because I think this campus is so unique in the sense that, we have the lease revenue fund, right, which is non-appropriated money.
Right.
We know that VA cannot use appropriated money on housing. We got the fact sheet, we got it. However, the lease revenue fund is not appropriated money, right? So there's a gray area there with regard to how VA wants to utilize the lease revenue fund. And given the conditions on the street, we felt as a board that the lease revenue fund, the highest and best use of that money, knowing that it cannot be used for permanent housing, was to use it for emergency shelter. So in our situation here, we didn't have, it wasn't, if we invested money in emergency shelter, we couldn't with permanent housing. We can't by law, right? The EUL program is there for a reason.
Yeah.
So that's why, we were very strong in passing that recommendation, saying this is a unique opportunity. This isn't like, we're taking away from the opportunity of building permanent housing.
Yeah, and I think to the extent you're seeing the demand and you have that availability, that makes sense.
Okay,
Vice Chair Mangano, Dr. Braverman, and Ms. Stanton.
Heidi, thanks again, of course, and I think we're particularly appreciative of the unique perspective that you bring, having worked for the VA for so many years and having been involved in a number of the initiatives that have gone on here, and now your work at LAHSA. I just wanted to address, actually ask you to unpack a couple of things in 2 slides. One of the slides is the state of homelessness with regard to the majority of people experiencing homelessness in LA County. On the second half of that slide.
With the ones people coming from other states?
Yeah,
Okay.
yeah. At our state homeless task force meeting, one of the concerns that was expressed by both elected officials and non-elected officials was the idea that while we would certainly recognize that most people, studies indicate most people who are homeless in a community actually come from that community, we do know in California, because we're a destination state and many, many destination cities, that many people come in, and obviously from your own slide, roughly 20% are coming in from outside of the state of California. So one of the issues that we wrestled with at the state task force was, should there be a priority in terms of state resources for those who are from California, and then to the degree that there are other resources that they would then be targeted to people coming in from outside, or should a homeless person simply be considered homeless and then we're going to allocate kind of equally across that? Just wondering from a LAHSA perspective, from your perspective, how are you all dealing with that issue?
Yeah, that's a good question. I think the first piece when we look at where people are coming from, it's hard to know. A lot of times individuals don't have documentation, they don't have proof of anything. So given the traumatic experience that homelessness brings to people, given the crisis that they're in, I think adding that additional layer of barrier would be problematic in serving individuals, especially to say, like, there are a lot of people from California who go to other states, and so from a good neighbor perspective, I think all of us thinking about homelessness as a collective government response and a responsibility is important, which is why I appreciated the recommendations from the task force on that. So I think when we're looking at homelessness from the LAHSA perspective, regardless of where you're from, it's about highest need, and how do we, one, given we have thousands of people coming in our front door, how do we assess what lane is best for you, knowing that we're not gonna have a resource for everybody, but getting people on the right path, whether it's the low need, the moderate need, or the high need, and then setting expectations along the way to best develop the service plan around them. But part of it really is a shift in our system of being very honest with people who are coming in crisis and saying, we can put you on a list and it's gonna be 3 to 5 years, so let's talk about some other options. But, can we get you to reunite with your family? Can we work on some of these other things so that people understand very, very frankly that what the reality is of them actually getting a housing resource. So our focus has been more on that, which the problem solving fund I alluded to has been very helpful in thinking of all these other creative ways that we can address your homelessness without full support from the homeless system, rather than, which part of the country that they come from.
So part of that, in that flexible fund that you have, would be reunification. I would say with the depth of social capital that people have elsewhere, where they have friends,
Right.
relatives, as opposed to coming here. And certainly we hear from providers in Hollywood that people come in and their sense is that those folk are sometimes much higher functioning than the homeless people here, so they perform much better in terms of getting to the resource. Is that your experience too?
Yeah, and I think Hollywood is such an isolated incident because it's Hollywood, and so we do frankly have a lot of youth who come here to pursue the dream of becoming a star, and that's real. And those dreams don't always pan out, and so I do think that that's something we see in the Hollywood area in particular, and that's why the youth services are tailored very specifically to them, because their needs are very different and they're not quite as chronic, and they might not have as many underlying conditions as someone else could. could.
But again, reunification is one of the strategies.
Reunification, we've even seen things like people who are trade workers saying, I just need this tool fixed and I can get my job back and get back on my feet, and we buy them a new tool and
Sure.
that's it. So it's intended to be as flexible as possible to provide any solution.
So just specifically for that 20% that we're looking at that come from outside of California, sometimes from outside of the country, is reunification kind of a prioritized perspective in
Yeah.
terms of that
It's
intervention?
diverting people away, when they come to the door, diverting people away from our system is the first thing we do regardless of where you're from. So oftentimes, if you're from out of state and there's a relationship we can help you mend, that would be a good path.
The second slide I just wanted to have you help us unpack is the one specifically on veteran homelessness, because that's what pertains to this group, of course. I know throughout California, there is this frustration that so much is being done to house homeless veterans, and yet we turn and the numbers remain, as they do here, basically the same. And I wonder if you could just talk about that a little bit, and I wonder too, if there's been a crosstab between people experiencing homelessness for the first time or newly homeless, and some of what we're seeing in terms of the replenishing of homelessness in terms of veterans in Los
Yeah.
Angeles.
So the veteran homelessness breakout is similar to what we see in the general population. So a high percentage of individuals experiencing first-time homelessness who are veterans. I also think that it goes back to what we talked about. What this is telling me is that we have an inflow problem and we have more people falling in, which goes back to the original point. If we had a way, even through the VA healthcare record or some of our systems, to identify who those people are who are coming over and over who might be at risk, it could be a way for us to help stem that inflow a little bit, so we can better address the needs of the other 3,800. So it's kind of a both and.
Haven't there been, I remember when I was in Washington, there were conversations with DOD
Yeah.
in terms of doing exit interviews, because you've mentioned a number of other systems where discharge planning is failure or non-existent, and as a result, people from mental health institutions, from foster care fall into homelessness. But certainly we know, anyone who's been on the front lines knows, people come out of military service with no place to go. And I remember conversations that were initiated with DOD to begin a process of identifying people who, at the end of their military term, there would be some kind of special intervention in the lives of those people so they wouldn't fall into homelessness, that we would preserve veterans from having to experience homelessness. But it just seems, from what our experience now is in the field, and this is pandemic across the country, and it certainly is evidenced in this slide, that as much as the good efforts are made at the local level, there's a constant inflow. There's no tourniquet on the hemorrhaging of veterans who become homeless out of military service.
Yeah.
Would you say that's a fair assessment?
Yeah, and you're gonna get me on my soapbox, but
Please.
when we talk about mainstream systems, I mean, I think this is the biggest piece, is the homeless response system, whether it's at the VA, whether it's LAHSA, is continuously charged with resolving these issues. We cannot solve poverty. We cannot solve structural and institutional racism on our own. These are really big issues. Things like DOD, even making sure there's housing security at exit, is a massive feeder into this, frankly. So I think the more that we can push all of these things upstream and truly get our other systems involved in looking at homelessness as a true risk factor, like, that's gonna be the only way that at the end of the day, we see a decrease in our numbers, given the economic situation that we're in California.
And I would just encourage you, having that dual perspective, having been with the VA and now being with LAHSA, anything that you can do to help push on that issue, because these numbers are sad, aren't they? That
Yeah.
many veterans have been housed by virtue of a Herculean effort, and yet when we go back and look at the numbers, there's no movement in terms of decreasing the number of veterans.
Right.
So your perspective could be very helpful. So
Thank you. And
yeah,
I would
thank
like
you.
just the trend that you're seeing here is very similar for families experiencing homelessness, about 2,900 families. We housed about that many, and there are still about that many more. And families in particular, I mean, you generally have 1 to 2 working parents, so that's not the issue. It's just making a living wage where we see the challenge coming in.
Dr. Braverman.
Hi, this is Steve Braverman, I guess for the record. just want to respond first to a couple of questions that have arisen here for clarification. One is, what's permissible in regards to the use of the money that we get from lease revenue? And the Appropriations Council for VA and the Office of General Counsel have opined that it may only be used for the renovation and maintenance of the land and buildings, and may not be used for those things that otherwise are inappropriate because of law. Now, I don't disagree that it's a gray area, and I don't disagree that it's worth pushing a little further, but that's what the current guidance is from our lawyers in OGC. The second piece is to also identify that easement revenue goes to the Treasury. That doesn't come to us. So monies that might be acquired as a result of the Purple Line, for example, right now would go to the Treasury. And I know there's legislative efforts to change that, but they haven't come to fruition at the moment. Thank you, Heidi. Great presentation. And I also want to thank you for enabling us and your group to, bring closer ties over the last few months, and we're going to continue to do that. There are two areas in your presentation that I didn't hear much information on. And one in regards to the demographics is there's nothing presented in regards to age of the homeless population, at least that I saw. And then the second is those that may address autonomy and choice. And the reason I bring that up is that in a lot of solutions that we've gotten from a variety of people, some speak to going back to work and being self-sufficient, but a large segment of our population, that may not be, an applicable goal. Our median age in general for our VA population here is 64, which actually is younger than most other VAs across the country, because we do get some influx of post 9/11 veterans. So one question is, and I've asked my team to try to identify that. We don't have that answer right now. Actually, we do have that answer. See what happens? Just ask a question, and 3 hours later, what you got?
So the average we have our homeless veterans, our average age. I'm Matt McGarren. I'm the acting chief of the service program. Took Heidi's place. The average age for male veterans homeless is 57. Average age for female veterans is 47.
Median or it's an average? There's lots of averages. Okay, so whether that's median, what I was referring to in 64 was median. So there potentially is a high number of older veterans, and maybe we have to have different solutions for them. That's one of the things that we'll look at. The other piece is that when we identify our veterans who have achieved housing, less than 30% of them ever went through an area where they had emergency or transitional housing. So that also speaks to your point about, do we need to have a transitional bed for every veteran that's out there? And probably not. Having said that, we have identified, as I mentioned yesterday, 4 locations in West LA and our Sepulveda campus that if we were to get funding for the acquisition of those beds, that we could potentially make modular housing or some other temporary solution. So just wanted to bring those up. Thank you.
And you can look further on the LAHSA website to your point about age. We do have a breakout, and last year we did see a significant increase in seniors experiencing homelessness. Senior being both, we break out over 55 and over 65, and that's a big, due largely in part to fixed incomes, again, not keeping pace with wages and people being priced out.
Okay, Ms. Stanton.
Thank you. Christine Stanley for the record. 2 questions. On the PIC count, if we encounter somebody that is ready to go into shelter at that moment, is there the ability to take them to shelter?
To the extent that there's shelter available, we tend to have pretty high capacity in our outreach team. We work with them consistently, but if there's shelter available and somebody's ready at that moment, we have the teams there, that would be the ultimate goal, yes, to be able to bring them.
And then my other question is more towards the board. If everyone's aware of the shallow subsidy, grant that's going on. It's the shallow subsidy is the continuation of the SSBF program, so it's basically part 3. So the veteran households that are either in the homeless prevention or the rapid rehousing, once they successfully come through there and graduate, or well, not necessarily graduate, but become low case management, and so based on their income and high rent burden, the shallow subsidy is like the extended, and we call it part 3, where we pay a subsidy based on their income and the number of rooms in their house for up to 24 months. So it fits into that prevention model, and it's new here in LA, where my office is managing that. We actually cut our first check today. So we're looking for families. I have some information that I will leave with everyone for that. But it is something that is going on. It's a VA grant, and we work all very, very closely with lots of my counterparts back there. So we appreciate her support that she's helped us model the program based off what LAHSA is doing with that as well.
And that's
Thank you.
something we're expanding to outside of the veteran space too, but VA certainly led the way on that effort.
Okay, we'll go Ben Winter, Dr. Davis.
Really quick question. Hi, Heidi.
Hello.
Great presentation as always. Want to go to the stubborn stat that Phil Mangano was looking at here, the number of veterans that are experiencing
Veterans' life.
homelessness. The 3,800 stat there. About approximately what percentage of these people are not eligible for VA services? And then, do you have any suggestions for this body to think about how to serve that population? I mean, our purview is how to build out these units of housing on the campus, but ultimately, if a large portion of these people are not eligible for that housing, like what are some solutions or suggestions you think we should be looking at?
So from the perspective of point in time count, eligibility for VA services isn't something we pull the thread on too much when we're doing the count and our demographic survey, but thinking back to my time at VA, and correct me, VA team, if I'm wrong, but it was generally around 10% of individuals who were not eligible to receive VA healthcare. I don't know if that's still the right number, but that's what we saw in SERS when I was here. So assuming that's still the same number, I think the VA has done a good job of looking at other programs outside of the HUD-VASH program. So SSBF is a great example. The Grant Per Diem program is a great example of programs that are eligible for people who might not be eligible for other healthcare services. But I think also working with the community on alternatives for people who might not be eligible for healthcare services. We have a lot of resources in the community, and to the extent we can get those people in the system and prioritize for care, we just need to make sure that we're partnering with you and identifying who those individuals are, so that when they do identify specifically as veterans, they don't just get sent back here, but we're truly looking at what the alternatives are outside of the veteran resource pool. However, like long-term, I know that there's a lot of talk in Congress and on the Hill right now about expanding the eligibility criteria for HUD-VASH. I mean, to the extent that the federal government has unlimited resources, it would be awesome to be able to serve everybody, but I don't know what the feasibility is of that, given the constraints that we have right now.
There was a reference, this is Linda Davis, there was a reference made to basically the transition phase from active duty service member to veteran. And that TAP, Transition Assistance Program, which is mandated, both enlisted and officer, is managed by both DOD and VA. The curriculum is jointly developed. It is administered on the VA side by VBA, and I've asked for the curriculum content related to any resource availability or awareness of for homeless, and so can provide that. I've also asked, one of the things we do in my office is not only the welcome kit, which I recognize the new members need to see, but which has all the resources available, but we do quick start guides, and these these are guides that enable not only the veteran and their family members, but our community-based partners and local agencies, et cetera, to be aware of, with one page, how you can access resources in a very clear, understandable, accurate manner. So I have asked while we've been talking, how we can develop one quickly related to the whole issue of homeless that can be then distributed, particularly to our community-based partners, providers here, and also to things like the community veteran engagement boards. The challenge with this is during the transition assistance program, for those of us who went through it, most of the time we just want to get out, we don't care, we don't hear what's said. And if it doesn't apply immediately, you may forget that it's a benefit that could be there down the road. So we have to keep the awareness present. Only under 10 million of the potential veterans eligible are enrolled in the VA. So there's another way in which we need to reach out. Yesterday, when the CVEPs were here, we talked about how we could help them as the community-based boots on the ground do that outreach, drive veterans to them when they're not able to have, for instance, their email addresses, like sometimes we or the State Department of Veterans Affairs have. So we're going to be doing a lot more on that, and I entertain that, all of that, for the committee's reference and suggestions.
Okay, we're gonna go Dr. Bamberger, Vice Chair Mangano, and Ms. Colchado.
Great, quick, so much of my research at the Breakout Initiative is trying to do what we call while we wait evaluations. While we wait for permanent housing, what should we do to keep our homeless veterans alive? A sprung shelter is an interesting strategy. I think it's great. What are you at LAHSA looking at in terms of self-governed, veteran-initiated tent communities on vacant federal and state and local land? Is there any evidence base that that's a good thing versus having people, as I saw as I came here this morning, camped along the fence on San Vicente?
So what we call a sanctioned encampment, so it basically designated an area in a property where individuals can go and bring their tents and encamp safely. So the answer is yes, we have looked at that, both at LAHSA, but also looked at other regions that have embodied this practice. And what we see consistently is a few things. One, while the approach might seem beneficial at the beginning, it actually turns out to be more expensive than shelter, not only from a services perspective, but from a public health perspective and from a law enforcement perspective, for a number of reasons. Two, LAHSA has a position paper on this that I'm happy to share with the board if folks want more information about other communities that have tried this. But two, what we're seeing is that now they're nearly impossible to shut them down once they have started because of things like the individual's rights when they're actually occupying the space in the land. And so right now nationally there's an effort going on to develop practices on how to shut these down. And generally it's taking 4, 5, 6 years to shut down the practice. So I understand the need for it. However, I think that the better alternative for us is to use our limited resources in a way that we know is evidence-based, that we know works, which is shelter and of course the permanent housing solutions that we're all seeking. And I'm happy to share the concept papers if you want.
As you alluded to earlier, the HUD-VASH voucher, that's the gold standard of all vouchers because landlords love them the best. But I know in Los Angeles there's been a difficulty in terms of once those vouchers are issued to veterans, the actual lease up of those vouchers. So I'm wondering, do you know what the numbers are now of how many veterans are out on the streets or in encampments who actually have vouchers but can't find a unit in which to lease them?
Sirs, you guys?
We have, it's about 600, right?
About 600 veterans looking for,
Correct.
with a voucher in hand.
Who have a voucher in hand, and then how many vouchers do you have that are not issued now?
About 19.
So there is a
About
substantial.
1,900 that are not not issued.
So there is a substantial resource available that's dormant right now, plus 600 on the street, and the difficulty of finding units to match with those, unfortunately, is getting worse, probably because of what you've talked about in terms of rents increasing across Los Angeles. So I'm just wondering again on that, if you could unpack that in terms of a LAHSA response to that issue, because obviously it's been a chronic one, and it really redounds to these numbers that we're looking at on that chart.
And I think Dr. Reddy's going to talk about this more when she comes up, so I'll try not to steal your thunder. But one thing we are doing that I think is making a lot of progress is, as LAHSA, we realized that the way that we govern across Los Angeles County is very diffuse. We have 5 boards, 5 supervisors, we have a mayor, we have a 15-body city council that has a lot of power built into that, so there are a lot of stakeholders at play. And we have a lot of different big health departments and public housing authorities that all have little pieces of the inventory that they manage. When I'm saying inventory, I'm talking about permanent housing resources. But there was no, and the VA is a big part of that too, but there was no central effort to pull all of those things under the same umbrella to look at it holistically, so we could say at any given time, we have 18,000 permanent housing units as an entire system, and of those, X number are utilized and X number are unutilized, so that the VAs and the Department of Mental Health and Health Services know where to look to say, okay, here's where we have available units. So LAHSA has a very good idea of the LAHSA resources and the utilization. I think the VA has a good idea of VA utilization, but we haven't been looking at it collectively. So LAHSA initiated what we're calling a Housing Central Command that started on Thanksgiving. Actually, I called Department of HUD and asked for technical assistance on Wednesday before Thanksgiving, and they were here Saturday. But the idea was to leverage approaches that came out of other communities like Houston, like North Carolina, where we had, in those cases, natural disasters that required systems to rapidly rehouse people after hurricanes. But taking the experts who went into those jurisdictions from a disaster response, emergency response lens, and applying that to Los Angeles, because I think we also have the need to rapidly rehouse a lot of people as our entire system. Bringing them in to bring everybody to the table to create a plan for, as LA, whether you're federal, state, local, how are we managing our resource inventory to make sure we have a unified awareness of what is available at any given time. So the VA's been at the table every single day. We have Housing Central Command, and we're breaking through barriers with the housing authorities to look at the process from the street to a unit, with the goal of having a universal dashboard that gives us this unified awareness. So the VA is a big piece of that, and I know is going to talk about some ramp-ups and some pilots, but I think a part of it is also the responsibility of the larger system to make sure that we're all understanding the issue from the same lens, and we all have the same awareness of what's available at any given time, so we can move anybody in as quickly as possible.
So just one final follow-up to that. In terms of the 1,900 that are dormant, where do they lie? City, county? Is the preponderance of them in the county or the city?
Most of them are LA County.
So roughly,
I don't think I have that breakdown.
but the vast majority of the county and some in the city. Thank you.
Okay, because of time, Letitia, you get the last question. We have doctors that are going to do the follow-up, and they in fact have patients to see, so we need to keep moving forward. Letitia.
So connected to Philip's question, Letitia Colchado. Heidi, I had previously heard that there were sometimes delays in connecting veterans to case managers who could process the VASH vouchers, and I know there had been work going on to resolve that. I just wanted to check in and see if that's kind of been resolved, or if there's anything this board could do to support our efforts to resolve that.
I would defer that to the VA on the status of the hiring. I can speak to how it was when I was here, but I'm sure there's a lot that's been done since I left too. So are you guys, I think you're planning to address that probably when you talk. But I'll also say that from the city, county, LAHSA side, we've also been working with the VA and offered up support in any way we can. So I think to the extent that's a VA challenge, we acknowledge that, and we want to be good partners in helping to support however we can. If hiring is the issue, the community stands ready to step in and help where we can.
Heidi, thank you very much.